Hi, I'm Dr. Rasya Dixit. I'm a dermatologist in private practice in Bangalore. I have been practicing from the last 18 years. So we all know that our parents always told us to use a gram flour scrub or a rice scrub to keep the skin looking more glowy or shiny. So this process is called a physical exfoliation. Why is exfoliation needed? Let us look at the normal turnover of the skin. The skin is an organ which exfoliates naturally by itself. So every 25 days to 30 days, our skin on the face, the older layers of the skin, the dead skin gets shed off, and then the skin starts making a new skin from the basal layer. The exfoliation rate is slower when it comes to the skin on the back and the legs, whereas the face it is 30, in the back or the legs it might be as long as 90 days. But this is a natural self-renewal process which is happening in the skin. But as we reach our 30s, or if you're under a lot of stress, exposure to pollution, or if you're smoking, this natural exfoliation process becomes more sluggish. This leads to dead skin buildup. The skin starts looking more dull, more wrinkled, more dry. And then you want to do the exfoliation yourself to encourage the skin to look more fresh, more hydrated, more bright. So how do you do this exfoliation? There are some creams which are good at exfoliation. There are some agents which are good for exfoliation. Glycolic acid, lactic acid, salicylic acid and retinol. These are the 4 components and they are present in various chemical peels. There are various creams in various quantities, concentrations, which promote the exfoliation of the skin. So, based on your skin type, suppose you have a dry skin, you would be asked to choose a lactic acid based exfoliant. But if you had a more of a oily skin, you could use salicylic acid or you could use a retinol. And this is going to encourage the skin turnover, making the skin look younger and fresher. An obvious problem with over-exfoliation is the skin becoming too dry, and then you have the same problem of the skin becoming more irritated, more red. So you have to choose your exfoliation correctly based on your skin type, and you have to make sure that you're following your essential skincare correctly. That means you are hydrating enough, moisturizing enough, using the correct cleanser. Some people may need a clinic-based exfoliation using a chemical peel or a microdermabrasion, which is a slightly more aggressive form of exfoliation to get more better results. Physical exfoliation using a scrub usually is not recommended because especially in Indian skin type, we have the brown skin type, harsh exfoliation may lead to pigmentation or formation of hyperpigmentation on the face or on the affected body parts, which is why most dermatologists advised against the use of physical exfoliants at home and against the use of loofah, etc., which could actually cause a secondary hyperpigmentation of the skin.